Very good evening, all the medicos listening to us. We are having the honor to have Dr. Krishna with us, ranked 30 in last INICET examination. So, beta, on the behalf of DAMS family, I congratulate you for this achievement.
Thank you so much, sir.
And how you are feeling after getting this top 30 rank, beta, rank 30?
I think if more than anything, I'm just relieved if finally I'll be able to practice my dream branch. And most of the, I'm happy, I can say I'm elated, but the biggest feeling I have now is I'm relaxed and I'm at ease right now.
So, beta, can you give some brief orientation from where you started your journey of PG preparation with DAMS, in which year?
Uh, I'm I'm actually a pre-foundation student. I enrolled in DAMS in my second year with all of my friends. But if I have to say, matlab, in the first 6 months, I had some problem with making notes and all. So if I have to say from a serious point of view, I started making my notes in my third year when COVID actually hit. I watched all the video lectures and I made my notes for in third and a bit of final year also. And since then, I gave my NEET PG in the month of March this year. Didn't do that well. Then I focused in the last 6 months. I focused primarily on the notes I made in third and final year and just solved questions. And that's pretty much all I have prepared. All the resources I have used.
So, Vera, let us start from the second year you joined, but you were not able to make the class notes. But in the third year, you were very sincere. So, if I ask you, okay, like getting this top rank in top 50, what was the single most important thing which you had done in the last 4 5 years, Vera?
If thing, if anything, if I see my preparation for the last 3 4 years, I can divide it into 3 years and the last 6 months. When I was in third year, when I was studying, I never had in mind that I have to score this and this much rank or I have to go and do this much PG. Every time I opened a book or I studied something, the goal in my mind was to how will this help when I go to clinic tomorrow or go to my postings tomorrow. We have postings from second year. So I used to think कि भाई ये पढ़ रहा हूँ देखूंगा ये इन्वेस्टिगेशन हमारे यहाँ होती भी है और क्यों करनी है अगर होती भी है. So I used to think like that. So in my third year, in my final year, even in my internship, when I used to go to postings, I used to read that subject. कि भाई we are going to talk about this radiological investigation. I should be able to explain to the consultant कि भाई इसलिए चाहिए हमें. Why do we need this urgently? Throughout for the last 3 years, whenever I studied, I used to study with this with my primary intention. In the last 6 months, when after my I got my NEET rank, I decided, okay, I know I have got my basics right there. I All I need to do is focus on the exam primarily, and then try to get as many questions correct as I need to. So I started focusing on the examination part in the last 6 months. Before that, my basics I knew I was good at my basics. I knew things. I knew the common diseases that were happening, how to approach diseases. But in the last 6 months, I focused primarily how to solve questions. That was the main thing.
What I'm getting from your words, beta, what I'm getting, okay, you focus on the class notes and you use your class notes to apply to learn the application of those class notes with the help of clinics. Whatever you have learned in
Yes,
the
sir.
class notes, you apply in the clinic. That is the best part. I say it is the best way of learning. Until unless you will not know how to apply the class notes, it is not no use. Beta. That is the best thing you have done in your PG preparation. You apply the things in the which college you are passed out, beta.
I'm from MCQs, Maulana Medical
Yeah,
College.
from MMC Delhi. That's great. That's great. And I will say every medical listening to us should take this message. Okay, don't miss your clinics, beta. What I'm getting from Dr. Krishna's discussion, okay, we should not miss our clinics because even you will feel okay, many students do this thing. Let us do rote learning and skip the clinics. And many students they give excuse that nobody teaches there in the clinic. But if you have basic class notes, you can apply those class notes in the clinics. Yeah.
So even if nobody is teaching, if you just open a patient's file, it will tell you so much. There will be so many ECGs. If you open I haven't read a ECG note for the last 2 years. I have just gone to clinics in my internship whenever a patient used to come. I just saw the ECG and discussed with my seniors. So I never had to see read notes from ECG, not from an ABG. So I was clear on those aspects. All I had to do was focus more on the para and preclinical things in my last 6 months.
That's great, Beta. And we again congrats you and we appreciate your effort. Like you are teaching, you are giving a very honest feedback. We should apply these things, and these things are missing, Beta, especially because your batch, I think, is a batch is who attended the COVID era, post-COVID era. And many students are still there in that COVID era. Let us do rote learning and we should miss all the clinics. And I will say very, well, honestly, I'll say the role of clinics is the most important in your success journey. Yes. Coming to the next level, Beta, in third year, you make all the notes of third year and final year. That was, as a faculty, I feel that was a game changer. Okay, because you have written all the notes
Yes.
in the third year. So I take this message from you that we should write our own notes in the third year itself. Importance of self-written
Yes,
notes
sir.
is some photocopies, Beta. Do you feel any difference?
So, I think when you write the notes, first of all, the that process of writing the notes itself has a greater retention period than when you just see the notes from somewhere. If you are a little active while writing, if you just don't copy, if you're just paying attention to what you are writing, that will you will have doubts that at that moment only कि अच्छा ये क्यों हो रहा है भाई इसको मतलब what ये तो ऐसे भी हो सकता था. You will have those doubts and then you can confirm it from other sources. Whereas if you are just, there, I have friends who have taken notes and they have done very well as well. So I don't think there's a hard and fast rule ki you have to do this way only. But what I have felt from my journey is if you make those notes yourself, you will have a better idea of what is written in them. You will know ki, acha, this I had this doubt while I was writing this. I should just check up on it or ask somebody. You will have a better navigation through those notes if it is their own. You can still manage if you are having general problem writing notes. You can still manage with I think photocopy notes. But in my particular case, I found my self-written notes to be much better.
Very true and very honest feedback you're giving. That's great, Beta. And Dr. Krishna, how many times you managed to revise all the notes, Beta?
I actually have a sheet with me. Can I share my screen? Is it possible?
Sure, our pleasure, but I want you should. I will just 1 second. Yes, yes. Yeah, is it possible for you to share the screen, beta?
I'm actually not sure. Okay, yes, I think there is.
Is
Okay, as of now, it's only showing that the host can share the content.
1 second, beta, 1 second. We have to, I think, change the setting. Can you show them? Do you have the hard copy?
Okay. Actually, I have it in my iPad. I can just say what I actually did. I made a sheet, and on the left side of it, I wrote all the names of all the 19 subjects, and I had set my target. I think when I started preparing, I decided that the key to score a good rank is revising all 19 subjects in last 1 week to 10 days. And to be able to do that final reading in the last 7 to 10 days, I have to revise a certain number of times. So in my head, I had it that I have to revise every subject around 2 to 3 times. So in the last 6 months, I saw okay, how can I revise those subjects in 3 times. For certain subjects, it was relatively easier. For example, anat, physio, subjects it was easier. But for subjects like pharmacology, we had around 600, 700 pages of pharmacology. I thought it was no way possible that I would be able to read those 3 times. And to do it in last 15 days, I will have to finish pharma in 1 day. So how to read those? So what I did that during my first reading, for subjects like pharma and micro, which were relatively larger subjects, I made short notes. I knew from my basics there are certain things if an option is given, I can recall it from the options. Ki, acha, for example, the rivastigmine question that came. I knew from from my basics, ki rivastigmine is used as a transdermal patch. So I didn't write that down. But for certain things, I didn't remember. For certain side effects, I just started writing those things down. So I summarized my 700-page pharma notes into around 60 to 70 page notes. And in my second and third reading, I just revised them. It took me, for example, if I would have just read my notes for my first reading. It might have taken me 2.5 It took me 3.5 to 4 months for my first reading. But I was able to achieve that in the next 2 months, I was able to revise it an extra time, up to 2 to 3 times. I was able to revise those shortened notes. So that was my game plan from the starting. I did that for most of my subjects. Then, when I realized, okay, I can accelerate my revisions through this process. So then as I started doing this, I got better at making those notes. I was able to make mind maps. I think for ENT, I was able to summarize everything in 20-25 pages. So I could revise the whole of ENT within, say, 2 hours or 2.5 hours. So that was the key to my plan. I knew that if I go by the hours spent, I will lose. I don't have the practice of reading, say, 16, 17 hours. I can read 10, 12 hours, but my game has to be to do something smart rather than just on sheer uh, hard work. I haven't done that kind of hard work.
I always,
I won't win if I do sheer hard work.
I always believe in that smart work, beta. What you are saying, okay, you should always concise the notes. And now I think, beta, try once, beta. Now you will be able to share the screen. Can you share?
Okay. Yes, sir. Is it coming?
No, just to share. It's not coming now.
Okay, okay, okay. Let me try one more thing. And oh no, it's still showing only the host can share in this meeting.
1 second. Now, can you try once? It's not coming.
No,
So
sorry.
what we are getting from your words, okay, we should draw the mind maps and we should concise the notes. And like you were saying, okay, you were able to revise ENT in 2 to 3 hours. Whereas that is the way we should proceed for 19 subjects. Now coming to the pattern beta, like the last INICET, the pattern was changed. You witnessed last INICET, last INICET. What was the difference beta?
So first thing about the exam was the major, I think the talking point has been those uh, 4 slots that was divided into the 50 question slots. And when the news came, I thought कि मतलब it was not such a big deal, which मतलब many people were making on कि भाई ये तो और कुछ नया हो गया, ये अब क्यों कर रहा है. I was clear in my mind. Even I used to solve questions many times. I used to solve them in 50 question sets. So I knew that I can solve a 50 question set in 30-35 minutes and I will have 10 minutes in my hand. In fact, I think the distribution into those 4 parts has actually made time management much easier. Because now revising 200 questions after solving them is more difficult. It is easy to go through 50 questions if you have 10 minutes rather than going through 200 questions in say 40-45 minutes. So that was a big change. Another key aspect was we discussed when we got the first news. I discussed with a very good friend of mine who discusses with me, Dr. Bhuvnesh Sharma. He's got All India rank 63. We discussed कि भाई कितने attempt करने हैं. क्योंकि when you are giving a 200 question exam, you have in your mind, okay, I have to attempt 190, 195, I will attempt accordingly. But in a 50 question set, for example, you get a difficult set. You don't know how the next 3 sets will come. So you don't know should I leave if I leave 4 here and 4 in everything, I'll be attempting around 184 only. So deciding how much you want to attempt with only 50 questions in front of you has to be pre-planned. So I had decided that normally in my GTs and all, I attempt around 190 to 195 approximately. So I divided it by 4. I got around 48 to 49 I have to attempt. If it is a difficult set, I will attempt 2 less. If it is an easier set, I will attempt 2 more. So I had in my mind, I had that clarity.
Bracket of 45 to 50, somewhere we have to go between 45 to 50. Absolutely. Very nice planning, beta. And
that was how I can.
Coming to the difficulty level, beta, how you compare the difficulty level of last 2 previous INICET examination?
Sir, last year, and there will be it will be slightly biased because that time I had less knowledge of the topics. But I thought the last time the questions were slightly more difficult. There were certain questions which you do not read in conventional sense. Like there was a question on a clinical trial. Now we don't read clinical trials in the names of trials in our day-to-day practice. There were certain questions regarding some newly approved US FDA drug, which was not asked this time. The common thing has been ki, I think it has been for last many INICETs ki they ask predominantly pre and paraclinical subjects heavily, especially pharma and anat they ask heavily. And pharma is one subject where I feel ki they, which actually makes a lot of difference. Because it is asked heavily and the questions are moderate to difficult level. Not everybody can answer more than 70-80% of the questions. So I have always felt that has been constant. This year, the difficulty has been slightly less. I would say 10 to 15% less. And I think that is pretty much it. The distribution has been pretty much same. There are always questions which will test clinical application more than simply knowing कि भाई 5 centimeter है reject कर दो. More than that, they have always asked कि to apply कि even if you don't know the cutoffs, you can get the idea from the options and the clinical scenario कि what to do in this question. That has always been the motto of INICET. So I think it has been slightly easier, but still a very competitive paper.
That's very nice feedback you are sharing with us, and I feel everybody will be listening to you, and these things will help in the upcoming examination. How you compare the level of MCQs in DAMS, like last INICET mock test, GTs, against your last INICET exam, the difficulty level of the paper?
Sir, difficulty level of the paper, I would say it is very similar to the one we gave in INICET mock that was just before the paper. I think 1 week before the paper. It was in around 25th of October. I think the difficulty level was very similar. And that was, I have given GTs of other platforms as well. And I think the framing of the question is very similar to DAMS. The DAMS questions that we solved in our GTs, the framing of the, especially the wording of the question, is very similar. There, in certain other platforms, I've seen that they try to twist the question a lot, which actually INICET doesn't do. It is very much straightforward. Sometimes the questions are poorly framed, but pretty much very much similar to the kind of questions we had in INICET mock. Difficulty wise, we have, well, I got to a stage where I know ki if I don't know the answer, if I am completely fogged by the question, ki I have no clue what the question is. It is a difficult question. I don't have to think much about it. I knew I have covered my basics. I have seen most, whatever I have revised well. I know if I still can't do it, it is a difficult question. If there will always be 30-40 questions, I think, where I would have gotten them correct, but if you ask them in a viva, I won't be able to do them. It is simply because I have been able to make a way through those options. There will always, there have been questions where I don't know the answer beforehand, but just by seeing the option and by ruling out those options, okay, this seems to be the correct option, I have been able to get, I think, at least 20 to 30 questions. And I have developed that ability to solve questions that I don't know the answer through multiple GTs that I have given in the last 6 months.
They're very nice, but a very nice description you are giving. I'm highly impressed with the way you are explaining each and everything. And I'm confident that everyone listening to you must get all the advantage in the upcoming examination. At the last bit, the importance of PYQs, PYT, which we conducted.
Sir, I think PYQs are highly important. First of all, simply the number of questions that are being repeated. That is one straight away. If the question has been asked previously, it is being asked again. Almost everybody will get it correct. So I think you just cannot you cannot go past without seeing previous INICET questions. NEET previous year questions, I'm not really sure how much they put an impact, but INICET definitely. Second, apart from the specific question that has been asked, it is possible that they won't ask the exact same question, but that is very likely कि if they have asked a question, INICET committee is interested in that topic. So they are very likely to ask the topic again. For example, in May, there was a question regarding the calculation of kappa. Now nobody knew the answer. Everybody, some people knew what is kappa, but nobody knew how to calculate a kappa coefficient. This year they asked they gave the kappa coefficient. They asked what was the interpretation. Is it showing good agreement? Is it showing excellent agreement? So this has been the pattern for INICET for the last 4 5 years. They always, when they have to introduce a new topic, they ask a relatively easier question and they follow it up with more difficult and more in-depth questions for the last 4 5 years. That's what I have seen. And apart from that, I think also I would like to mention that many of my friends who were preparing through MCQs, what they were solely focusing on was PYQs. He, if, I think for a 6 month period, there are around 200, I think around 6,000 MCQs there are, which are PYQ INICET. If you can easily solve them within 1 to 2 months. Wrong. What I also would like to advise somebody who's trying to prepare is also solve some questions that are beyond PYQs also. Because after a certain amount of time, those PYQs become very repetitive. You just know the answer, you don't apply the brain. Whereas in an actual exam, you will get questions you will have no idea about. You need to have the ability to deliver the answer when you have no idea what the question is asking, or you have minimal idea. You need to be able to find a way through those questions कि ऑप्शन देख के अच्छा ठीक है ये तो नहीं होगा ये तो इसमें पड़ा था हो सकता है इससे it might mean this. You have to make certain correlation, and you can, the only way to do that is to solve as many questions as you can.
Very true, Beta. Very true. That's nice. I'm confident. Whatever branch you will take in Central Institute, you will go to the next level, Beta. The way you are dissecting the things, awesome, Beta. Great, great. I appreciate your efforts. I appreciate your way of explaining the things. Nice. Which branch you're, yes, planning to
The
join?
surgery.
Sorry, that's great. So their confidence is awesome. Now, Beta, coming on the last spell, any special message for your parents because of whom you are here on this platform with me?
So, matlab, if I have to give, matlab, if I don't see where I would be if I didn't have the support of my parents. Most importantly, I would like to say when I was in internship, I wasn't really focusing on how to clear NEET. I told my parents that कि इस बार तो मतलब I am focusing on learning things and stuff, and I cannot handle both of these things. And they told me it's okay. You just do whatever, just whatever you think will be best for you. Do that. When I got a rank of 5,000, I asked my father. Papa, should I join some? If I get a peripheral college, should I join? He told me, why didn't you study in the last 6 months or so? I told them because I wanted to give the exam in my peak. He says, then you should do that. You should give the exam in your peak and don't bother about. I am there. You don't have to bother about things like this. You wanted to give the exam at your peak. You give the exam at your peak. If you get a bad rank, doesn't matter. You will see when that comes. But yes, my parents have always
That
been
is that is the
nice to
spook
me.
which
They
is
have,
that is the thing which is required, Beta. Nicely, uncle, the way he explained you, he justified, okay, yeah, you should give the exam at your peak. So that is the best thing. That's great. And convey our regards to them. And this success, I feel it's their success. Yes.
yes, absolutely.
Coming on the DAMS family, Beta, what was the role DAMS family played in this last 3 to 4 years of journey?
मतलब, a lot. I would like to say this, even though I'm taking surgery, my favorite subject throughout has been OBGY. And it is solely because how well it was being taught in our classes. And well, a lot of my knowledge comes from what I have gained through the DAMS family. And after my parents, probably the biggest role has been through my teachers in DAMS family. I have seen your lectures as well. And
Thanks for all.
and it is, yes, sir.
Thanks for your compliments, Beta. I convey all these words to.
And I used to I have always been a hosteler. So I used to come to study in our college library in MAMC. So first, when I was living very far away, I used to solve MCQs in the metro. But then I shifted closer, so it was 10 minutes ride. I used to listen to uh, podcasts by Dr. Sumer sir on Spotify. So that it had a lot of questions that it answered a lot of questions that I had in my mind. So apart from the studies and the subjects as well, DAMS has helped me through a lot beyond the books as well. So I will always be grateful for that. I would also like to thanks Dr. Sunny, to thank Sunny Pahuja sir also, because I remember when last time I got my rank, he came. My roommate had got All India rank 6. My best friend had got All India rank 6. He had come to take his interview and he asked me how was I. I was a little sad that time. So he just asked me, "Come, अरे कोई नहीं पार्टी करते अरे आपका तो अच्छा होगा." मतलब हाँ मतलब he goes beyond the relationship of a institute and a student. So I would really like to thank him on this video as well. So if he's seeing this video, so
That's
that
the
will be
best
really
part
nice.
of that's the best part of DAMS family बेटा. Rank आना नहीं आना वो बात की बात है. But we always take our students as our family बेटा. That's best thing, and I will convey your message to even Sunny. And definitely thanks for all these compliments बेटा. And lastly, I want you should give
Thanks.
some special message to some of the students who were most eligible students, but they couldn't perform well in the INICET examination. How they should proceed for the upcoming NEET examination बेटा.
Sir, I think I have a lot of my friends who were very good, who were doing very well, didn't perform that well in the exams, and there are friends who I thought who didn't. There are many students who didn't do well. What I would like to see is many of them going back to the recall and seeing where did they lag behind. If it was some basics, they should go to the back to the drawing board and make a plan. Okay, what type of questions, and rather than the subjects, what type of questions am I getting wrong? Are those basic questions which are recall based? So you need to increase the revision. You need to form a strategy that has to work. And if there are questions which are application based, which okay, somebody else is nobody knows the answer, but people are able to guess those answers, then that is simply practice of PYQs. मतलब a good teacher of mine, he used to say कि preparing for an exam is a science, solving an MCQ is an art. You can teach how to solve, how to prepare for an exam. Okay, study this much, study that much. But when it comes back to solving an MCQ, you have to be affluent with it. You have to have done that 1,000 times to be able to do that in exam. It is very much a skill. Solving an MCQ is very much a skill you need to acquire. So for those of my friends who think they have lacked the practicing element, they need to go back. There have been some of my friends who have ticked all the boxes but haven't done well because they panicked in the exam because they didn't. I just need to tell them, that, bhai, if you have done well for so much time, you have the goods in you. You just need to believe and remind yourself. If you face 2, 3, 4 difficult questions in an exam, just remind yourself, I have studied. If I'm not able to solve this question, this is a difficult question. Everybody will face difficulty in this. Everybody will play on the probabilities. And let's just look at the next question. If 5 questions are difficult, doesn't mean the sixth will be difficult as well. So I would like to give that message to all of my friends who will be preparing for the next exam. And don't, this is, I have taken a lot of tension for the last 6 months. So I do agree that it is a tough journey, but you need to, the only thing that will carry you through is confidence in yourself and the people around you.
Thanks, Peter. Thanks for all these kind words, and I'm confident of what we have discussed in the last half an hour will help thousands of students across the country. And thanks a lot, Peter. Dr. Krishna, for coming on this platform. We again congrats you, wish you very best of luck. Thanks. Thank you, Peter. Thank you.
Thank you, sir.